Hello, my name is Jessica Crunkleton. I am a licensed marriage and family therapist, licensed mental health counselor, certified alcohol and drug abuse counselor, certified EMDR therapist, sand tray therapist, and a whole bunch of other stuff. This particular video series is entitled Grad School 101, and I'm creating this series to help individuals who are planning to go to grad school or who are in graduate school, who are seeking degrees in counseling, marriage and family therapy, social work, working with addiction counseling, things like that. I'm just sharing some tips, some things that I learned along the way, and just some things I wish I had known going into that juncture of my life, starting that journey, of that part of my life. Again, like I said, I'm now fully licensed as a therapist, independently licensed, and I love being a therapist, but there are just some things I wish I had known back then. They probably would have saved me a lot of issues. So one of the biggest things I wish I was known, I'm so excited about doing this video today, is that talk therapy is not enough. It may not be enough for your clients. Now, I don't want to say it's not just enough for anybody. There are people, talk therapy, that sort of thing. It works really well, but there are other ones, especially when we talk about trauma therapy, working with clients who have had different traumas. Talk therapy, that might just not be enough. Okay. And so I want to kind of get into that. And so I brought along my brain. See, you see that? And I brought along my body. I need to give him a name or something. Maybe you guys can help me come up with that. So these are things whenever I'm working with clients, or when I'm doing presentations talking about being a trauma-informed therapist, these are things that I share, that I talk about. And so I remember in graduate school, awesome training. It was a great training. Don't get me wrong. I graduated with a master's in marriage and family therapy, community counseling, great practicum experience, great supervisors, great everything. I graduated in 2012, and I'm not sure if at that time, I don't really remember us talking a lot about trauma. We really didn't. I think that might be more into programs now, but that was 10 years ago. Maybe it was a different time. We talked about it, but not in those terms. It was a bit different. Okay. So, but one of the big things is, like, I know we were trained a lot to do like CBT, structural family therapy, couples therapy, all these different modalities. But I'm thinking about now, as I look back on it, working with individuals, working with couples, working with families, the one thing I wish I had understood is sometimes talk therapy is just not enough. Okay. And I think had I have known these things, if I had known these things, it would have saved me from having burnout, which is another reason why I'm doing this video series. A lot of individuals start out in this field and they end up leaving within like 2 years. They get burnout, they get overwhelmed, they don't get the support they need, and they leave the field and they never return. And that's unfortunate because there's a lot of people that need support. And I think maybe if people were more informed about how to treat some of these issues, maybe they would stay longer. I can't say that for sure, but that's just my thought. So there you have it. So I think, I went through 2 serious episodes of burnout as an associate level therapist, and it really weighed heavily on me. Actually, no, one was when I was associate, one was when I was fully licensed, clinically licensed. But I think it started way back in graduate school, and just kind of the way that I thought about clients, that I thought about supporting clients. And so that's again why I'm doing this. And so as a talk therapist, a therapist trained in talk therapy, you're often taught that if you talk to people, they get better, right? So we talk about, you have a problem, we talk about it. I take you through the sync quiz. We do we do cognitive restructuring. We're looking at your the errors. We're doing all these things, and we're doing some CBT work or other things, and then you're going to get better, right? And that's how it works. And it can be effective for a lot of people, and there were lots of people I work with that did get better. However, there was a segment of the population that I work with that I saw in graduate school. This came up, but it really came up when I was an associate licensed therapist, because in grad school, they kind of try to structure it in such a way that you don't get more like complex trauma quite as much. You get more simple traumas and things like that, and lesser challenging clients, but you're still going to see it. You just might not know fully what's going on because it just shows up in different ways. But the big thing that came up I would talk to clients, and we would be talking about stuff, and then they wouldn't feel better. In fact, they would feel worse, talking about their trauma, talking about their past rape, the car accident, the divorce, the loss of their child, these different things. They didn't feel better. They would feel worse. And sometimes they were like, I'm not going to come back because talking about these things is causing me nightmares and I'm thinking about it and it's stressful and I just don't want to do this anymore. And, I just remember thinking, I feel like there's got to be something else out here, because this is not working. And so that's when I came across EMDR, and I am an EMDR trained therapist. EMDR works great for dealing with PTSD, complex trauma, anxiety, depression, a whole bunch of other things. And I wish I had known that in grad school, because maybe I would have sought training as an EMDR therapist back then instead of waiting till I was several years into my career. I think it would have helped me. It probably would have helped my clients a lot more. The other thing about talk therapy is that it can be very taxing on you as a therapist. Okay. So as you're going through your clinical training, you'll probably notice at the end of sessions, sometimes if you're doing talk therapy, you kind of feel like, because the client has come in, they've told you all these things, you're trying to help them work through, you're trying to fix it and help them to do that. And you feel very responsible for all those things. And I would say, for me, as a trauma-informed therapist who specializes in EMDR, sand tray therapy, other trauma-informed therapy modalities, what I've learned is to take the pressure off me as trying to fix things and utilize EMDR or sand tray or other modalities to kind of help address some of these things. And then I think the big takeaway is, and I don't know if it was Alan Shore or Stephen Porges, I think it was Alan Shore that said this, but you can't heal nonverbal trauma. So if the trauma happened early in development, 0 to 2 before they had language, or, 0 to 1, those things, you can't heal that type of trauma verbally with verbal talk therapies because it's pre-verbal, right? So we have to have ways to address those traumas, to address the things that happen to the client. And this could be whether they saw it as trauma or not, but you can't address those things with verbal just talk there, because these are pre-verbal. So we have to have other ways of getting to it. The other thing is when we talk about trauma and how trauma can get stored in the brain and in the body, we are really talking about, just a combination here. So it's not just left brain. And that's what I think of when I think of just general talk therapy. It's more left brain, higher level thinking, very intentional about what we're doing and things like that. That's not how trauma works, though. Trauma is, I was 5, a dog bit me. Now I'm 55. Every time I see a dog, boom, I am afraid again. I am a 5-year-old again. I am definitely afraid. I'm in danger. I'm going to die. I'm freaking out. You can tell me over and over that dog ain't going to do anything to me. It's okay. It's a little dog. It's in a cage. In fact, it's on TV. It's fine. You can just get over it. It doesn't work like that. Trauma gets stored in the wrong part of the brain, more as we're thinking about, I would just say more right side and in the body. And so when we think about the left brain, it's later to develop, right? It's more the facts, things like that. This is verbal. And it's more what we know to be true. The right brain is more intuitive. I just have a gut feeling about this person, about this situation. It's earlier to develop. It's nonverbal. Okay. And it's artsy. We think about creativity. I think I'm really more of a right brain. You have both, but that's how I think of it. And the problem, here's where the issue comes in. When this event happens and it's so overwhelming for the client, the system gets amygdala hijacked, things get out of whack. The issue is not stored. The trauma incident is not stored in the left side of the brain. If it was, it could be processed and made sense of, and there you go. It gets stored in the right side of the brain or in the body, which is why people can have panic attacks, different things. You think about people having nightmares, all these different things, getting triggered by stuff. In the present, you're like, what's going on? But that was 10 years ago. Like, what are you doing? This is not a conscious thing that the person is doing. So I would talk to clients. I would try to, teach them all these skills and all this stuff, which was great. But then when they went out into the real world after session, they would come back to me and say, Miss Jessica, if it was a kid or something, it's adult, I was trying to use those skills, and then I forgot about them. They said something about my mom, or my husband did something and reminded me of the past, or I just got really upset and boom, I was off. So fight, flight, freeze, fawn, maybe they run away, maybe they have different reactions. And I know for myself, I have an ACE score of almost 10. I am a childhood trauma survivor, lots of different stuff. I've done a lot of great work on that. But one of the things I distinctly remember is being about 9 months pregnant. My husband, we had our first big marital argument. I remember thinking, I told him I'm going back to Arkansas because that's where I was from. Keep in mind, we were living like Northwest Indiana, Chicago, several hours away from Arkansas. But I remember saying, I'm going back to Arkansas because that's my home place. That's where I'm born. And that's where my grandma's house is. And my grandma's house has always been my safe haven. And if I've ever had trouble, I could always go to my grandma's house. So that's where I was going. So when that moment happened, I was not a 30-year-old woman making a clear decision. I was a child. I went back into that. Something triggered me, and it wasn't even on a conscious level. In fact, I didn't realize it till we went to therapy later. We're talking to the therapist, and she's like, yeah, you're a runner. And I'm like, what are you talking about? And yeah, so I was a runner. I'm going to flight. I'm getting out of there. I'm taking off. So people have different responses to trauma. So keeping this in mind. And so again, I'm not saying that talk therapy cannot be effective. It can be. I've used it with CBT and a bunch of other things with a lot of clients. But also keep in mind that there are other ways to treat things, and you might need to be thinking about utilizing some of those modalities, such as EMDR, sand tray therapy, play therapy, or other modalities that really get into the nonverbal parts of things. And also, I think, in particular with EMDR, we utilize the adaptive information processing system. So we believe within the person, AIP, it's always there within them, like to function in a more adaptive way. And if we can just help them kind of reset, kind of clear up some things, kind of make sense of the past and what's in the present and what's in the future, and differentiate. Because when people have gone through trauma and traumatic experiences, things get clumped together. They get mixed up and confused, and it just can cause issues. So they're not able to make that differentiation. That's where this issue comes in. So with EMDR, we give the brain another opportunity to take a look at things and say, wait a minute, yes, that thing happened. I was 5 then. It was really bad. It was a horrible experience, but I'm 55 now, way further in time. I have skills and things that I did not have at 5 to address this issue. I can ask the owner to leash their dog. I can run away. I can call 911. It's a little bitty dog. It's not a huge dog. Maybe I even could like dogs if I give myself some time, right? So we start making these distinctions that didn't happen before. And the brain is doing it. It's not you as a therapist doing it. You're just saying go with that, or having them tap, or however you're doing it. But it happens, and it can happen pretty rapidly. I've seen this be really effective for phobias and a whole bunch of other stuff. But the main thing I want to say, and this is again, for those in graduate school, but also associate level or advanced beyond that, I would highly encourage in your grad program, if you can, try to get in an EMDR basic training. I know for me, I am an EMDR consulting basic trainer and training. I see a lot of interns. I would love to see more interns, graduate interns in the program. So whether you're doing social work, mental health counseling, marriage and family therapy, I think even addiction counseling, it doesn't matter. As long as you're in your practicum phase and you're able to see clients, we can try to get you in one of these trainings, because I think this will be really helpful to help you so that you won't go through a lot of the issues that I had to go through and a lot of therapists have had to go through. So if you have that type of training, then you kind of know where to go with clients, you know how to structure things in a different manner. And maybe you even say, maybe this is a bit advanced beyond, maybe I'm going to pass this one along, or I need to get more training in a different area to be able to reach my clients. So that again is my hope for you all, to encourage you, to help you to understand that it may not be that, it's not that you're a bad therapist or you're doing anything wrong. It might be that you just need more modalities, more ways. You need to think about the client in a different manner, to understand them and they're presenting issues in a different way, and to know that this is early early trauma. So it might not be that you're going to be able to heal that with a talk therapy. We're going to do brain therapy when we do EMDR or some of these other modalities. Okay, so some talking in there. It's not just processing, but there is, again, I said there's a time and place for everything. But I think EMDR works great. Sand tray, some of these other things. There's a bunch of stuff. But the main thing is to be thinking about having more tools in your toolbox. And also, I think for you as a therapist, being contained and taking good care of yourself as a graduate counseling intern, making sure that you need to do to take good care of yourself, that you're able to contain, compartmentalize. This again is something else we teach in the EMDR training. And I know in my grad school program, they said you need to compartmentalize, but nobody ever taught us. That's what we're going to teach you in an EMDR basic training and things like that. So those things can be really important. So again, key takeaways. Remember, talk therapy can work for a lot of people. I'm not saying it can't work, but when we talk about trauma or certain issues, you need to be thinking about the brain. And really what we're saying here is the brain has been traumatized. There's been an injury to the brain. So we're going to have to approach this in a different way than we would if there was just, like more minor issues. This stuff is in the body. The body keeps the score, right? So the way that we approach treatment needs to probably look a bit different, depending on the person, the situation, that sort of thing. All right. See you on the next one.